because I've been through so much medical transition,
Mhm,
when that's all your life is as you're growing up,
mhm.
I'm now an adult. I've had my entire face and body changed. My bottom surgery completely failed. There's no recovering it. Every surgeon I've talked to refuses to fix it because it would probably kill me. And now I'm trying to figure out what do I do with my life because it just hit me that this mission that I was put on is not real.
Hey, everybody, I caught myself another one. This one, wow. Anyway, before we move forward, I am going to tell you thank you so much for watching my interviews and getting really helping me get these beautiful, amazing guests on, which have really been so great. And the comments everyone leaves and everyone's being so respectful and awesome. It just really makes me happy to see. I think that we're building a bigger space of respect and dialogue, which is everything I dream of in this crazy world right now. So with that, remember, like, subscribe, hit the button, share this with your friends, do all those cool things. It's really helping this channel. So today I have this beautiful human being. Her name is Briana. Is that how I pronounce your name, Briana?
Yes, you got
And
it.
I got it.
Mhm.
I can't believe it. I got it. Awesome. So, anyways, Brianna's here. So why don't you introduce yourself, friend, and then we'll move forward.
Yeah, so my name is Briana. I'm 22 years old. And right now, I actually work two jobs. So I'm a
Okay.
model in Chicago, and then I
Wow.
also just started working in finance.
Wow, right on.
Mhm.
So, wow, those are
Yeah,
two totally separate
very.
places. You're
Yeah.
only 22. Good for you, friend. And
Thank you.
you're a trans woman, yes?
Yes.
You're a trans woman. Okay, great. So, I mean, you look so great.
Thank
Probably people
you.
don't believe it. So, in this day and age, you look I'm gonna say it.
Yeah.
I don't.
And the
You
crazy part is, I've only been out as trans for a week.
Oh, so okay, let's get into this. This is excellent. So first, I want to know. Tell me the reason why you reached out to me. Could you tell me that?
Yeah,
Hmm.
I reached out because this conversation has become so relevant right now. And I honestly never thought it would. I had gone through some of the experience I had told you. And when I had started, we were still talking about gay marriage. So it was a few years into transitioning. We were talking about trans people in general. And then within the last like 2 years, it's been childhood transition.
Yeah,
And
yeah,
my experience became like the forefront of the
yeah,
trans conversation.
hmm,
And I've
yeah.
seen a lot of activism from the trans community that I just do not align with. And it goes against the entire experience that I've been through.
Mm,
And two things motivated me to do this. One, I saw a surgeon that I had previously spoken to that's promoting surgery on TikTok, and you can book an appointment through text. A
just
nightmare, a nightmare.
unbelievable.
And then also, it's mostly trans adults advocating for kids transitioning,
That's right.
and they have no idea what they're advocating for.
So you, my friend, transitioned as a young person, did you not?
Very.
Tell me what age you
I
started. Yeah,
mhm.
excellent.
I knew I had feelings of gender dysphoria at like 6, 7.
Hmm.
I remember that vividly, and that never changed. I discovered the word transgender
Hmm.
actually from jazz on TLC.
Okay.
And I knew that I felt very similar to that.
Hmm.
And I was around 12 when I found out who she was.
Okay.
And immediately I was 13 and I began to transition. So I began to present
Wow.
myself as female, changed all my
Wow.
clothing, hair, makeup. I started practicing everything. And then
Wow.
that was the same time I started puberty blockers and hormones.
So, wow, you went on puberty blockers.
Yep, all of it.
Is it possible I could ask you your location? You don't have to tell me where you live specifically, but what
Oh,
state or
I'm in
where you.
Indiana. It's a red state.
So you
Mhm.
started all of this in Indiana.
Yes.
Wow, at 13, so you got on
Mhm.
puberty blockers. So your parents must have had to have been involved somehow,
Yes. Mhm.
and they were totally okay with it.
Yeah, it was really interesting because we all didn't know anything about being transgender.
Yeah,
None of us.
yeah,
And so we went to a gender clinic for guidance
right,
on what to do.
right.
And I immediately from that day fast tracked my transition. Like, and that's what a lot of people don't know is really going on. It's not just kids starting a transition. I walked in there and they reinforced to me and my family that I had to do everything as young as possible.
Wow, holy moly.
Yeah. Before I was 20, I think I had 4 or 5 procedures.
Before you were 20.
Yeah, my
So
entire body. Mhm.
wow. I mean, obviously something worked out for you, and obviously,
Mhm.
you seem very happy and very focused, which is the most important thing for me. But what
Yeah,
as you know, I am really against childhood
me too.
transition, as many of us. So this is so interesting. So here you are going to the doctor, you're 13, you have dysphoria. I believe you do. I probably had dysphoria as a
Yeah.
kid too, right?
Mhm.
I'm totally in alignment with all of that. I mean, I grew up in the 60s and 70s. I'm like
Yeah, like,
literally
oh my god.
I'm like your grandpa.
You had to fight for that testosterone. Okay.
Totally, totally. So that being said, here you are, and you go to the doctor, and the doctor in the clinic. So I want to know, like, did they give you
Mhm.
any like mental evaluation for a certain amount of time, or was it just sort of like bam, bam?
I had one appointment with a social worker, and we had talked about, like, my childhood, which things had happened. It happens to most trans people,
Sure,
honestly.
sure,
There's a lot of things that go on,
yeah,
but it was quite affirming. Like, it was definitely I knew that I was gonna start transitioning.
yeah.
It felt more just like, "Oh, we kinda have to do this." So,
Okay, so there you are. So do you feel on? I think you did say it already, but you felt on some level fast tracked, just boom, 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 boom. You went
yes.
from so you went from puberty blockers. What age? Like 13, and then
Mhm.
how long were you on the puberty blockers for?
I was on them simultaneously with the hormones.
Oh, okay,
Mhm.
okay. So then
And
you
then I
decided.
stopped.
Mhm.
I believe it's called Lupron.
Yeah.
I had stopped that after a few years though, and then it was just hormone replacement.
So you were like a
Mhm.
couple of years on Lupron, and then you went straight
Mhm.
into estrogen. And then when did you get
Yes.
your first? What was your first surgery?
I had my nose and breast implants at the same time.
And do you mind me asking how old you were when that happened?
18.
Okay, 18. Wow.
Mhm. And
You
then
are fast
6 months
tracked.
and 6 months after that, I had a butt and hip augmentation and my bottom surgery.
Oh, so you also have bottom surgery. So you're
Mhm.
full on completely, totally surgery, like totally.
Yes. Before I was
Okay.
20.
Gosh, Brianna, I really appreciate you being here and being so
I
honest. And
appreciate you.
oh gosh, it makes me so happy, just to have this conversation with somebody who's actually willing to have it. And because, a lot of people in our community are not willing to be honest and not willing to talk about these things. But it says a lot about you. I kind of feel teary eyed for some reason because I just don't think people are honest enough about these kinds of
No.
things. And it's not okay because we have to be honest about this in order for the future of
Mhm.
our community to be healthy. So at 18, you're full on transitioned. I mean, you look
Mhm.
amazing and all of
Thank
that, and
you.
you're passable as a woman. I don't think anybody
Yeah.
would ever even have a clue. So when you did that,
Mhm.
I guess my question is, did you live as a trans person or did you just live as a woman?
I lived as a trans person as long as I could, up until
Okay.
I started passing. And
Okay.
that was something and a really unique part of this that I've always wanted to talk about
Yeah.
is that the doctors had sold me and my family the idea that they could make me a cisgender female.
Wow.
And
Wow.
that's why they had constantly reinforced to me that I need to have these surgeries done fast.
That's right.
They
That's
had
right.
convinced my parents that I had to do it young or else my recovery would be awful. They said it was perfect for me to do it all at once right now.
Who are these so, the question I'm gonna ask you is, we haven't been doing this for a long time. So,
No.
yeah, that's right. So on some level, you're one of the very first
Mhm,
on some level. You're in that lump with jazz.
mhm.
You're in that space with
Yeah.
jazz for sure, which is very rare.
Yeah,
I'm
we're about
telling
the
you
same
as an
age.
Oh gosh. I'm telling you as an elder in this community and somebody who transitioned 30 years ago, we never talked about kids transitioning ever. It was never something people spoke about. It was never something we told children they could be. It was always trying to get them out of the dysphoria, right? Trying to sort of
Mhm,
work with them mentally to say, hey, wait a minute here. Let's go through puberty. Let's figure it out. If by 20 you're still feeling this way, we'll move forward. But literally at 13 they're like, you can be a girl, and
mhm.
they're lying to you because I don't care
Yeah.
how amazing you look, I don't care what you've done to your body, you're still biologically
Yeah,
male.
absolutely. And there's nothing wrong with that,
No,
but I
that's
was
the
told that that was wrong.
oh,
Mhm.
I swear I get so mad at these conversations.
Yeah.
I just, oh, it makes me so yeah, they told you you could change your sex. That's what they told
Yeah.
you.
Mhm.
And then when did
Yeah.
go
They
on.
had made me feel that I had the potential to be different from all other trans people. If I do all of these
Wow.
surgeries really young, full
Wow.
puberty suppressed,
Yeah.
hormones for the rest of my life,
Yeah.
I would be a biological female. And it made me hate trans people.
Wow, I can
Yeah.
totally imagine because you don't wanna be associated with that, you wanna
Yeah.
be a woman. I mean, you had what we used to call a sex change, right? And
Mhm.
you totally had that. I mean, that's really what they're promising you. So here you are, you're a youngster and you're transitioning and everything going good for you? Do you feel solid in your space and happy?
No.
Okay. So what's going on then with you as you get these
Yeah.
surgeries and you take these hormones? Is your
Mhm.
yeah? Tell me what's happening.
Going through that much medical transition all at once
Mhm,
before I was an adult
mhm.
did not help my mental health. I felt like I watched my body be completely reconstructed within a few years. And on top of that, the bottom surgery was the worst experience of my life. I was lied to about it, and it was an experimental one that has no research and is not even for trans people. It's for cisgender women with deformities.
Oh my gosh! Wow. So like a cis woman who maybe has a big, clitoris or whatever.
Mhm.
Yeah, yeah. That we can say. I mean, YouTube
Yeah.
is so insane. Believe me,
Yeah,
I
I
don't even have
know,
to
right?
blurp it out. I'm like,
Okay.
clitoris. As if I'm saying something.
They'll pull that check for anything.
As if I'm saying something bad.
Right.
I'm like, it's so ridiculous. I'm always nervous. Am I allowed to say pee pee poo poo? Like,
For
so,
real. Like,
so wow. Oh gosh, this is so heavy. So yeah, so they have a surgery to help genitals of
mhm.
biological females fix that situation.
Yeah.
They used that surgery on you. Oh
Mhm.
gosh, wow. So yeah, you were a guinea pig.
Yeah, I was the youngest trans patient to have that technique done.
Wow, wow.
I was 19 and I was told that it would be completely identical to a cisgender woman's genitalia.
Mhm.
And they told me the recovery would be easy because I was young. And they told my parents that I had to do it young. I didn't even know this until a few weeks ago that the surgeon had called my parents and they had a private conversation in which he told them that I had to do it and I could not be older or else it would be a lot more complicated. And in reality, that's the opposite.
Oh my gosh, friend. Wow, this is really just my mind is blown. I mean, I knew I was going to have a killer conversation with you, but my mind is blown. It says so much about this medical space. Everybody thinks doctors are, some doctors are just gross and they have a
Yeah,
god complex, I think. And people
they
just
do. A lot
look
of
at
trans doctors do.
they totally
They're
do. They think
creepy.
they're creepy. They think they can actually change you and mold you into this. He had a vision for you
Yeah.
on some level. So they full on told your parents that. Did they ever use that trope? If Briana doesn't do this, she's going to kill herself. Did they ever
Oh,
say
yeah.
that to you? They did.
I had heard the
Wow.
whole trans women live till 30 thing, yeah, since I was a 13, 14,
This is
and
so
I was
that's
terrified.
my God, Brianna, that's child abuse. That is actual
Oh,
child
yeah.
abuse. That is not okay. First off, for a child to be hearing stuff like that, and secondly, lying like that is so absurd, and it's really manipulative, manipulating your parents, manipulating
Mhm,
you. So here you have this bottoms. So what I had heard also was that when you take puberty blockers, your genitals don't grow. So was it harder for you
mhm.
to have the surgery then?
Yeah, so that's why I had this one, because typically
Oh,
they invert the penis,
right, right.
but for me, I did have some, but because I was on puberty blockers, it was only a
Yeah,
little bit.
yeah.
So this technique, they went into my stomach and took the lining of my stomach and used that as the organ.
Oh my gosh. Wow. So now, so does that give you any kind of health effects or is everything okay with your stomach?
I have really dark scars that never went away. I do feel more discomfort in that area. It's gotten better
Okay.
over time,
Okay.
but the surgery itself, every complication possible happened.
Yeah.
And the doctors lied to me about it. While I was going through complications, they told me that it was normal and it wasn't until the point of no return. And it completely blew up. It was an
So
absolute nightmare.
could you would it be possible for you to
Oh, yeah.
elaborate on some of the
Mhm.
problems you had? Okay, great.
Yeah. So
Yeah.
immediately after, I couldn't walk for a long time. And on top of that, this is another part of the creepiness of it was I remember after the surgery, staff of the hospital, residents, all kinds of people, doctors were bringing in and my surgeon were bringing in to look at me
Oh
and
wow.
talking about how I was the youngest person they'd ever seen to do this. They'd never seen this done. It was like a science class for them.
That's right. Totally. Yep.
Mhm.
Yep,
And
you were a guinea pig. So they're showing off they're showing off. That's what they're doing. Also, they're
yeah.
showing off their surgery to the other surgeons. Like, look at
Mhm.
this. Yep. Okay. Yep.
And then a few days after, I had severe blood clotting in my legs, and they only
Wow.
found it because I had a fever and it was on the way to my heart. So I was on blood thinners for the next 3 months. I went home, I started the dilation process,
Mhm.
and it felt like a knife going inside of me.
Wow.
It was awful. And when I called the doctor telling him what was going on, he told me that it was normal and that I just need to take antibiotics. I didn't even have an infection. What was happening was the organ was collapsing inside of me and it was developing scar tissue and traumatizing my pelvic floor.
I'm so sorry, friend. Oh, this is just devastating. And you're 18 or something. How old are you?
I was
Okay.
19.
No, okay, 19.
Mm-hmm.
What? This is traumatic. I can't even imagine. So the
It was
doctor's
horrific.
completely did the doctor have you come back in to take a look at it?
Not until months later.
Oh my God. So basically you're like, something's wrong. And he's like, just
Yeah.
take some antibiotics. You'll be
Yep.
fine.
Mm-hmm.
You know how many times I've heard this, not necessarily just from trans women, but trans men too, having
Mm-hmm.
complications with their top surgery and all kinds of weird stuff. And the doctor's just like ignoring them or telling them to take aspirin or they're
Yep.
overreacting or, you know what I mean? I've heard it a lot more than I ever should.
Yeah, I've seen it too. And it's a doctor that I actually had consulted with. I found a story of one of her patients and that happened.
Wow. Okay, friend. So, gosh, already I'm just like,
Yeah.
this is not happening to you. So now here you are at 19, struggling with your,
Mm-hmm.
bottom surgery. I
Mm-hmm.
can't. How did that act? How did your mental health? Tell me about your mental
Destroyed.
health. Yeah. Yeah.
Destroyed. I didn't know if I wanted to live anymore
Mm.
because I was sold the promise as a kid that I honestly wouldn't have to be trans. We can
That's
turn
right.
you into a biological female.
Wow.
If you
So,
do it all before you're an adult and we get your whole body done and we have your puberty suppressed and you do hormones, my parents and I genuinely believe that. We
of
thought that I
course,
wasn't really a trans person, that I could be turned into a biological female.
but You see what they're doing? They're trying to get rid
Mhm.
of trans. They're
Yeah.
trying to make us into, biological men and
Mhm.
women. You are biological women and me a biological male, which is
Yeah.
completely impossible. And also, number
Mhm.
two, we're transsexuals for the
Right.
rest of our lives, and
Absolutely.
there is no problem with that. I've lived with that. And I didn't have doctors like that. I had doctors who
Mhm.
didn't tell me that. They said you're going to be doing this for the rest of your life. You're going to be in this space for the rest of your life. They were my doctors were extremely honest 30 years ago. So
Yeah.
that's so interesting to me and now I find the newer generation of trans doctors and all of this are this idea that they can literally change your sex, which is what happened to you.
Mhm.
So here you are thinking you're going to become this woman and everything's going to be fine. Your
Mhm.
whole life is going to be hunky dory, but now you're dealing with a horrible bottom surgery and your parents struggling along beside you, right?
Oh my god. The amount of guilt that they
Oh
feel,
God.
the amount of shame that I feel has been awful. That's why I've lived stealth since I was like 16.
Sure.
Mm, and
Sure.
because this whole process really made me hate being a trans person
Yeah. I get
because I
that.
thought that I wouldn't have to be that way.
Yeah.
I thought that I would be able to get out of how trans people are treated, how they're
Yeah.
seen in the world,
Mm.
and I thought that I could be above that.
Mhm.
And it wasn't to be mean to other trans people,
Mm-mm.
but it was because I was sold that idea at a time when I was so vulnerable as a kid. I wanted anything to make me normal. And so did my parents.
Of course, because you were struggling with that dysphoric feeling,
Yeah.
right? But the thing that I want to say also, and not to say that you're not trans at all. That's not what I'm saying. But I
Mhm.
think that a lot of kids deal with with not necessarily gender, but they deal with stuff, right? They want to maybe look like a boy
Yeah.
because it looks cooler, or they want to be a girl because they like fingernail polish, or you know what
Mhm.
I mean? There's just so many variables, but I feel like we're just shoving a person into these spaces. What was it that sort of made people diagnose you with dysphoria? That you really just were very feminine and wanted to dress that
Yeah,
way, or
pretty
yeah,
much.
yeah,
Mhm.
which is totally me,
Yeah, I
opposite.
grew up in an environment where a lot of people around me did not like gay men. Like
Yeah,
being a feminine boy was very negative.
that's right.
And I developed the idea really young that being gay was bad.
Yeah,
And I thought that becoming a heterosexual woman was better. And it
you are.
seems so contradictory from the doctor's point of view, too,
Yes,
because
yes,
just me even saying that I was feminine, that I didn't feel like other boys, they were like, that
yes.
means you're a girl.
I mean, wow, you see it now, don't you?
Hmm.
You see that now. They didn't say, let's explore this. Let's
Nope.
calm down. Or let's say, okay, well, so what? You're a feminine boy. Who cares, right? Like
Hmm.
maybe you're just a feminine boy. It's not, doesn't mean anything really. Maybe you are a homosexual guy.
Hmm.
Maybe. I'm not saying you are, but you understand what I'm saying? Like they just immediately shoved you. That feels very homophobic to me. I don't
It
know about you.
is. And now I'm 22 years old. I'm only 22.
God, I know you're a
And
baby. You're a baby.
yeah, and I'm now thinking about who was I even supposed to be? I don't know.
Oh God, I'm so sorry. Like I can't even imagine what you're going through at 22. You should not be going through this. You
Yeah.
should not. And I can't even imagine that you're probably questioning your own existence on some level, right?
Yeah, I needed so much more time. Transition should be a much longer process. There should be a lot of conversation, a lot of reflection in it because
That's
it's
right.
major. It's irreversible.
Thank you for
And
saying that. Thank you.
yeah.
Thank you. I love you. Thank you. I'm not kidding. More people like you need to start saying that because there are people who were on puberty blockers. I can say it till I'm blue in the face, you know that, but I didn't
Mhm.
take puberty blockers. I transitioned a long time ago. I transitioned as an adult, blah, 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 blah.
Mhm.
You, my friend, went through everything that I'm seeing. I'm
Yep.
seeing what you went through as an older person and saying, hey, wait, what? You're saying what I wish that people would hear me say. And that's why I'm saying
Mhm.
you're brave, you're amazing, you
Thank
care.
you.
Brianna, you care about this
I
community.
really do.
You do. There's no doubt. You wouldn't say it if you didn't care. You would just go hide and or do your thing and not be vocal about this.
Yeah. And that's what my plan was originally. But then I realized there's a lot of kids put through what I was through, but they're living stealth
That's right.
and they're embarrassed. and they feel a lot of self-hate for being trans, and they
Yeah,
don't want any association with being trans.
that's
Because
right.
when we're put through an entire medical transition before we're adults, we think that we're not really trans, but then we don't know what we really are
Oh my
because our
God.
entire body, face, everything has been changed.
But they're confusing you. They're
Yeah.
they're not they're not letting you like organically, right? Organically grow into
Mm-mm.
your own. It's why I'm so happy I transitioned at 30. I struggled, Brianna. I did. I'm not gonna
Yeah.
ever lie about that. I struggled on many, but I dipped my toe in so many things and was a gay woman, a butch woman. You know what I
Mm-hmm.
mean? I even sort of lived a little straight for a while. Like I just dipped was in so much. I struggled, there's no doubt. But I'm solid in my transition at 30 years of transition. And also I don't feel like I can't talk about myself being a biological female. You know what I mean? Like because
Yeah.
I'm old and mature enough to understand that. But when you tell a 13-year-old little kid, we're going to change your sex, which is a
Mm-hmm.
complete lie. Totally.
Yeah.
Totally.
Completely. And it's only within the last like 2 weeks that I've been okay with that I'm a trans woman, because I
What?
was truly convinced that I was going to be cisgender woman. And then when it didn't turn out right, I didn't
Wow.
even feel human. So I
Wow.
just never talked about it again.
Well, I mean, duh, I completely understand that. Why would you?
Yeah.
No, you wouldn't, because you're not supposed to be a trans woman. You're supposed to be a cis woman, right?
Yeah.
But in your brain, you're going, actually, I'm not, but I feel embarrassed to talk about it because then I'm going against everything that is supposed to have helped me move in this direction because you're
Yeah,
fully
absolutely.
surgery too. You have full
Mhm.
surgery. You could be anywhere and nobody would ever know that you're a trans woman because you
Yeah.
look like full women, even your genitals, everything.
Mhm.
But you can't change the brain. That's what people
Nope.
keep forgetting. You can't
Mm-mm.
change
And
the
it catches
brain.
up to you, and it caught up to me within the last like month. I just had
That's
enough. I was like,
wow.
I'm lying to myself, and
Oh
it's
my
not helping
God.
me.
What a powerful statement you just made, seriously, because that's what people need to see. I don't care how much you suppress, right? It's what we used to do with gay people. We used to suppress our homosexuality because we didn't want to be gay because we would get, beat up or whatever. So we all pretended we weren't gay. It's the same thing that's happening. Now that gay's accepted, who cares, right? That's why I keep
Yeah,
saying we have to accept our transness. Trans women aren't
we
women.
do.
Trans women are trans women. What's wrong
Yeah,
with
we are
everybody?
different things. We have different needs. And I was lying to myself like I didn't. And now here I am. I'm 22 years old. I have different needs. Like, no shit. I should
No
have known
shit.
that from the beginning.
That's
But they said
funny.
no. They said no, 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 no. We are going to make you identical. I was told
Wow.
that word for word. Before the bottom surgery,
Wow.
they said it would be identical, that
Wow.
no one
These
would know.
people. You know,
What a lie.
the lawsuits are going to come. I don't care.
And I'm working on it.
Good
Mhm.
for you. You know what? Oh, if whatever you need from me to support you, I'm here
Thank
because
you.
we have to hold these doctors accountable. They are not helping us. They are hurting us. It's literally all going to be taken away from us, even for adults. It's all
Yeah.
going to be taken away because of the disingenuous players in this game, the liars, the cheaters. I always wonder, Brianna, who do you think who's in who's like why did this happen? Trans was fine before. I'm telling you, I lived this life a long
Mm.
time. All of a sudden there's this weird agenda in the trans space that we have to be men and women and biology isn't
Mhm.
real, and all this weird underlying transphobic, if you ask me, the trans
Yeah, it
community is
doesn't make
transphobic.
sense. It's
Mm-mm.
contradictory
That's
because
right.
one feminine trait about a boy and that's a girl now. What do you mean? I
What do you
needed more time. I don't regret presenting as a female, but I needed more time to understand the right way for me to do it.
That's right.
And I lost my entire childhood and being a teenager because I was on an operating table. I was in and out the clinic every day.
My
Like I was
God.
never a regular teenager.
No.
I lived in the hospital
Oh my
and getting
God.
surgeries. That's what I thought I lived for.
Oh my God.
They put the idea in my head. And also, another thing that I want to address,
Yeah.
and this is particularly common in trans women,
Okay.
surgery is a status symbol.
Oh, wow.
Like, for a long
Oh,
time,
oh, oh.
if you were a good trans woman, if people liked you, people thought you looked good, it's because you were all done up. And I saw that as a kid online. that the happiest trans women were the ones that had surgery. And then I had doctors that capitalized on that.
That's right.
And they had told me that you will have a better chance of being seen as a woman if you do this all before you're an adult.
But where are they getting that information from? Because we don't have any studies.
Their checks, that's where they are. Yeah.
You're awesome.
They drained us of everything.
Oh
Mhm.
my God. I'm so
Yeah.
sorry. I'm so sorry. Your whole family is suffering. See, that's
Yeah.
what I also want people to hear out there. It's not just Briana, it's the whole family that takes on this journey. And your parents feel guilty, I'm sure. They feel so um let's talk now about how you are living your life as a female and
Mhm.
how you changed the way you thought. I guess my question is, how are you living now? How comfortable are you living in the space you're in?
It's become very uncomfortable. I am now, because I've been through so much medical transition,
Mhm,
when that's all your life is as you're growing up,
mhm.
I'm now an adult. I've had my entire face and body changed. My bottom surgery completely failed. There's no recovering it. Every surgeon I've talked to refuses to fix it because it would probably kill me. And now I'm trying to figure out, what do I do with my life? Because it just hit me that this mission that I was put on is not real. And now I have to figure out how to live a life like this. And I also don't have sexual feelings or function at all. I lost that a long time ago. And so it's made being an adult really confusing, because now I'm thinking about kids, but they asked me if I wanted to have kids at 14. And of course I said no, because why? I was a kid. And so, but at that point, I was completely sterile. And now at only 22, all my ideas about who I am are starting to contradict the way I felt as a kid.
I feel so sad. I feel so sad for you, and I care a lot about you, Brianna. It's gonna make me cry because you shouldn't. This
Oh,
should never happen to you. And you know, why are we doing this? Why are we telling kids they can do this? And then at 22, you should never be dealing with something like this ever. It's a shame.
it's, yeah.
It's
And these doctors know it. Yeah. And that's something that I thought about a lot. And what I'm really going to go after is, they are well aware that all of these medical interventions, hormone replacement as a kid, and even doing a completely experimental bottom surgery on me that has no research for any trans patient. It's only been done on cisgender women that were born without vaginas. And our bodies are still very different.
that's
But
right.
one surgeon in New York tried it on a trans person, and my surgeon wanted to try it on me.
How is that legal? I don't understand how that's legal.
I have no idea. There's no way it can be.
There is no way. That is an invasive You know what you have to do to just have a
It was 7
breast?
hours.
Oh
Mhm.
my God, that is a long time to be in surgery. 7
Mhm.
hours on a. What were you, 18 when you had bottom surgery, or how old
Yeah,
were you? 19.
19.
Yeah,
Mhm.
you're a kid. That is so hard
Mhm.
on your body. And then how long did it take you to recover from
Yeah.
that surgery?
They told me it would be like a month. I was recovering that entire year.
Wow,
I
wow,
didn't get,
just wow,
I had started college. I never got my degree
because you couldn't
because the
function.
recovery was an entire year. The bleeding got worse, the pain got worse. My pelvic floor was traumatized, and it was completely collapsing on itself.
My God, this is so
And I didn't
insane.
find out until the end of that year, when they finally actually took a look, and they said, there's no recovering this.
Oh my God, you should be pissed. I'm
And
pissed for you.
yeah, and he was trying to convince me to get a second one done.
What?
But he said the only way to do it was to do a skin graft of the colon. So he was sending me to colorectal specialists to see what they thought and if they would do the procedure. They all told me that that could never happen. Like
Wow.
with what has happened to my body and my pelvic floor, they all refused. They were like, this will kill you if we do this to you again. And my surgeon was still trying to get me to do it. He said that they were lying.
He said they were lying. Oh my God. He was
Mm-hmm.
willing to put your life on the line to do this
Yep.
surgery because his ego. I'm telling you, these doctors have
Mm-hmm.
huge egos and they want to be the first,
Yeah.
right? They want to be the first to make this sort of vagina. I mean, they're talking
Yep.
about implanting
He was fascinated by it.
See, they're talking about implanting uteruses in trans women. What?
Jesus Christ, for what?
For what?
For what?
Vanity. It's
What do we
vanity.
need that for?
You don't. And why would you take such a risk to
Right.
do that? It's fucking sick, man.
They just like experimenting. They're fascinated by it. A lot of trans doctors are. They're really creepy.
They're creepy. I know.
Because my surgeon, yeah, he learned, and I'll say her name, Dr. Gallagher. She's the biggest one on TikTok.
I know Dr. Gallagher.
He studied right under her.
Makes all.
She was going to do my surgery. And then she relocated to Florida after my consult, sent me to him.
Oh my God, they're tag teaming.
Yep.
They're tag teaming. Do you mind saying the name of your...
Oh yeah, Dr. Joshua Roth.
Okay.
Everyone needs to know that.
That's right.
And then after he had me hop around to all these surgeons that were saying no, then he cut off all contact with me. And I was still having complications from the surgery. And I just had to live with it and let it close up.
That's exactly what the young trans guys were telling me with the top surgeons. They just stopped talking to them. They wouldn't return their call. They wouldn't have anything to do with them because this one kid's whole chest got infected and it was nasty. God. And it was like, nope, stop returning calls. How
they make it feel like it's your fault.
Oh my God, I'm so... Briana, I just can't even believe this happened to you. So now your brain is like, hold up here. Wait a minute. I'm not really a lady. I'm actually really...
Right.
I'm a trans woman.
Right.
And also, no one gave you the opportunity on some level. And what you said is so powerful. You said at 14, you never would have thought about saving your sperm because why would you? You're 14. No 14-year-old wants kids, and that's like you can't ask a kid that question. I didn't even want to have kids up until 4 years ago when I got kids. You know what I mean?
Yeah, and and they also put you in a situation where it doesn't make sense either. And what I mean by that is, I'm 14 years old. We're already intimidated by the entire process of this and what they're telling me I need to do in order to be happy. And then they're like, well, you can freeze your sperm, but you'll have to pay every year for how long you want to keep it frozen. And there's so many costs with it.
What?
So, of course, why would I do that? I'm 14. I don't give a fuck about kids.
That's right.
I am one.
That's right. You're a kid. And they're asking a kid, you're going to want to have kids when you're older. And no, doesn't work. Doesn't work. I've been trying to say this forever. Everything you're saying is gold. It's gold. And you're using your really horrible situation to stand up to this. You have huge amount of integrity, my friend, and you have a huge heart. You don't have to do this, you know. You don't have to.
Yeah, no. I thought I was just going to have to carry this as like a secret the rest of my life.
That's right.
But seeing it so prevalent in the whole trans conversation right now, I just wanted someone to put their face to this.
Yes.
And I decided it just had to be me.
Oh my God, you're amazing.
Because nobody knows what it feels like to see yourself shapeshift into a completely different person. And you're not even an adult yet.
Wow. It's so
like bizarre. So much surgery I've been through. I feel like majority of my life has been surgery and hospitals.
That's right. To change you into a woman because you can, but you now, and then all of a sudden your brain was like maturing and your brain goes, wait a minute here. So, and they didn't even give it. I think you did talk a little bit about the fact that you're sterile and about and also, I don't know if this is too personal, but your sex life.
None. I Since I was a teenager, I don't even really know what true sex drive feels like. I'm not sure. I've kind of learned from other people.
Sure. Sure.
And as crazy as it is to say,
Yeah.
but even after the surgery, I have so little sensation in that entire region that it doesn't even feel sexual, really.
And
Yeah.
how about even like in your brain, or like do you get feelings of
No sex
that
drive at
no
all.
sex drive because they
Mm-mm.
knocked it out with the
Yep.
Lupron?
Yep. It'll
They
kill it. It killed it fast. Yeah. And now a part of what came to this realization is that I was thinking, am I asexual?
mm,
And it's
mm.
like, well, I guess that would make sense.
But you were forced into that. You
Right.
probably were never asexual.
I'm
You're
sure it made me asexual.
100% it
Hmm.
did, because you don't have a choice. But you don't even have a choice. You see, this isn't a choice you're
Hmm.
making. It is something
And I
that has
wasn't
been.
told that.
That's right. Oh, you weren't told that it's going to.
Nope.
Wow, these people are crazy. That you
Yeah.
have such a huge lawsuit on your hands. These people are crazy. Like they're
Yeah.
not. Remember when everybody keeps saying, "Oh yeah, you get informed consent." Well, to make informed consent, you have to
No.
have the pros and the cons of what's going to happen to you, right?
Nope. I've only discovered these things years after. I had no idea any effects of the hormones, of the puberty blockers, and I went through a lot on those. There were times that I wasn't dosed properly, and I was 16, 17, starting to go through menopause symptoms.
Oh my God! What?
Yeah, like
Wow!
severe hot flash. And
Wow!
because my dosage just wasn't properly done.
Because you're a guinea pig.
Hmm.
They don't know they don't know what they're doing. Also, Lupron is not made for you. It's made for kids
No.
with precocious puberty, and it's made for all kinds of other crazy shit that they do on women with cancer. And it's a gnarly drug. I'm sure you know
Yeah.
now
I'm
what you.
still trying to figure it out.
Oh
Yeah.
my God, I'm going to send you so much.
I feel like I don't know enough.
I do. I'm going to send it all to you. I have
Yeah,
people
please do.
I'm going to send you so much information, because I connected to women who were
Hmm.
biological women who were given this because they had problems down there, and they had to use it for something, cancer or all kinds of. And it said it ruined their
Oh my
life.
God.
It
Yeah.
ruined their lives, and they're giving this to children,
Hmm.
and it ruined your life. I mean,
Yeah.
I'm sorry, but living without ever having the feeling of sexual attraction, or having sex, is completely insane to do that to you.
Yeah. It's hell. I feel like I'm missing a part of life
You are.
that is so critical. And it's not that that's all life is about, but it's a huge
No,
part of it. It's so
it's.
important.
Are you kidding me? I just can't even believe they would do that. That in itself is makes me insanely pissed off, because we all have to discover sex. Sex is a part of procreation. It's a part of
Hmm.
life. It's a part of being intimate with another person, right? There's so many great things that, I mean, that's why we are sexual beings, and they just took that away from you. They took it away from you.
Yeah. And now I'm 22, and it's finally hit me that
Yeah.
the promise I was sold of them seeing,
Yeah.
let's see if we can turn a biological boy into
Yeah.
an actual biological girl. And that didn't happen. And so now I'm 22,
Mhm.
and I'm like, I have my entire adult life, but I have no sexual function. So what does that mean in a relationship? Now I want a family. I can't do that. I want to be in a long term relationship, but I have no sexual desire, no sexual feelings. I don't even know what that feels like. So I don't really know how to do any of that.
My
And
God.
it and I woke up even like a few weeks ago, and I was like, I don't know what to do. Like, the promise I was sold was never there. It was never going to happen. And they knew that, because on
Yeah.
top of that, after the bottom surgery failed,
Yeah.
they cut off all contact. And I found out a few weeks ago, they wiped all of my medical records. They wiped my clinical summaries. There's no information about
Oh,
what happened to me. The paper trail's all gone.
look at my face. I'm like,
Hmm.
uh, wh- uh, what? I don't
Hmm.
even know what to even. That has to be illegal.
Yeah,
That has to
very.
be. Why would they do that? Why would they do that?
I think
Do you,
that they were aware of what was being done. they know that this is so experimental, especially as young as people like me were.
That's right.
Like, and that's why I was even inspired to start talking about this,
Yeah.
because of the entire push that transitioning a child is life-saving when it's life-taking.
Oh God. You
And
said
these
it.
people knew that they were doing that to me, and I believed it. And as soon as I started to push back because of all the complications and the pain I was living in, they just completely vanished.
Because they don't want you to speak out on it. You know that.
Yeah.
They don't want your voice out here. You will actually destroy everything that they're doing. You are powerful, Briana, because you went through it all, and you are a badass. I can see it in your
Thank
eyes.
you.
You are not going to take this sitting down. You're not. You're a
Yeah.
badass. And they did destroy on some level your life, and
Yeah.
you're the one who has to live with it, not them. They basically just did whatever they needed to do. It didn't work out. See you later, alligator. No, no, no.
Yeah.
And you're not the first for this, and you're not going to be the
No.
last if we don't speak out.
Yeah. And I think I was inspired because I saw a lot. I hadn't even heard of this word until a year ago, but detransition. I
Yes.
started seeing their stories, and I empathize with them because a lot of them have been through bad medical practice
That's right.
and were given things when they weren't even really trans.
Mm-hmm.
They didn't have a diagnosis. They regretted it, and now they have lifelong consequences from it. And I wanted someone like myself. I had gone through everything as a kid, and I hadn't really seen a story like that. I had seen some people on puberty blockers and hormones, maybe a surgery, but mine, that gender clinic had convinced me and my family. It was like a package they were selling me. Look, we can do all of these procedures like back to back to back to back. We can completely stop the puberty, completely replace the hormones, have you all surgically done right when you turn into an adult. And we think that that will just make you into a woman. And so you won't have to be weird in this world as a trans person. You can just skip that. And it made me hate trans people.
Of course, because you didn't
Up
want
until
to
like a few months ago.
Why
Until
do you
I
think?
found there were some that had some sense.
Well, yeah, we're starting to speak up. The trans women and the trans guys are
I'm so
starting to.
grateful.
We're like, this is not going to happen on our watch. So we have to. I have to as an elder. I have to. I cannot sit
Thank
here.
you.
This made my life amazing. I have to tell you, but I chose this at 30 after I lived
Mhm.
a full. I'm 61 now. I lived half my life as a female and half my life
Yeah.
as a male on some level, right? But
Mhm.
I never looked back. So same with me. I never saw detransitioners before. It
Me
wasn't until we
neither.
started bringing in young people. And that's the
Mhm.
problem right there. We're trying to tell young people they can change their sex. And you just
Yeah.
said it. Nope. I don't care. You look like a woman, you talk like a woman, you walk like a woman, you probably
No, I'm a
smell like a
biological
woman.
man that
But
presents as a
that's
female. But I
that's
was made
right.
to feel like that's really bad.
I
And that you just
know.
need that we can just make you into a biological woman. Don't even worry about that.
I know. It's weird. Why would they do that? Why what do you have any idea of why they would do that?
There's
Why
so
they,
much profit to be made off of a trans kid.
money, money,
Insane.
money. Did
Massive.
your insurance pay
Massive.
for most of all of your stuff? Or did you have to go out of pocket?
Like portions of it. Like it depended on what it was.
Okay.
Like some of the medications had a copay.
Mm-hmm.
A lot of the procedures besides the bottom surgery, no. But the bottom
Wow.
surgery they did.
Oh, they did. Yeah.
Mhm.
Wow.
Which I don't even know how that kind of a bottom surgery got approved.
That's right. They
It's
did
not
it
even like a traditional one that's been done longer on trans
right.
people.
Right.
I was the youngest person to ever have that, and it's a surgery for cis women.
Oh my. What's the name of that surgery? Is it
A
vaginoplasty?
peritoneal pull through vaginoplasty.
Peritoneal pull through.
Yeah. Yeah, it's
Oh, because they had to
PPV.
pull your lining of your stomach through.
Mhm. The first time
Holy
it was done on
moly.
a trans person was 2017. I had it
Wow.
almost at 2020.
So only one person before you. Only
Like
one.
only like a handful.
Oh my God.
No one as
That's
young as me.
insane.
No one as
It
young
was
as me.
And the fact that they would do a surgery like that on a young person, that's what we're
Yeah.
trying to stop. That's what I'm trying to
Mhm.
stop. I don't care what anybody says. No
It's
kid
so
that
over medicalized. Everything.
Oh my God, it's so crazy.
Yeah.
I didn't have bottom surgery. I live a great life. You know
Mhm.
that. I'm
I wish I
perfect.
never did.
I'm so
Mm-mm.
sorry. I just
And I
think I'm
needed time to
sexy.
figure that out.
That's right. That
I
is the
needed more
genius.
time
Oh my God.
because I'm happy with presenting as female, but now I'm 22 and I
Yeah,
miss my fucking old genitals.
I can imagine. I
I
just
just
can't
needed a
even.
few years to figure that out.
That's right. That's right. And you never even got to really
Yeah, that
experiment
happened to
with
me
that
2 years ago,
because the
and I already
Lupron.
regret it.
Oh my God. Oh my God. See, the regret rate is
Mhm.
just going to skyrocket. And
Yep.
who's going to be who do you think is going to be held responsible for all of this?
That's what I'm trying to figure out. Is I
Yeah.
don't understand where this within the last couple of years this insistence
Mm,
on such a rapid medical transition.
yeah.
It takes so much time for even
Yeah.
traditional cisgender people to figure out if they want like breast implants.
That's right. That's
Like,
right.
but then we're telling kids that think they're trans, okay, here's the full medical route and you can do it in a couple years. We'll just get
Oh
you in
my
and out, in and
God.
out, in and out.
It's homophobic. I'm telling
It
you.
is. It is.
These kids, a lot of these kids are gay or just like funky kids who just,
Yeah.
whatever, have
I
a
needed time to figure that out. But I had
wow.
already had the idea just from these interactions and
Yeah.
meeting with the therapist and the doctors that it is better to go through a full medical transition and be heterosexually the other gender than being abnormal in that gender and gay.
Oh my
Like I
God.
really had that idea.
Jesus.
Like I did not like the idea of being gay. I
Of
was like,
course.
no, let me have every plastic surgery and just be a girl instead.
That's right.
Because that's
That's
what
right.
they were encouraging.
They totally were encouraging. They were saying that you would have a better life living as
Hmm.
a female than you
Yep.
would as a gay man. That's exactly that's
Yeah.
conversion. How dare this community talk about conversion therapy when that's basically what
Right.
they, on some level,
No, it's completely backwards. And people don't
wow.
really realize it until someone says exactly what you have to go through as a kid when you
That's
do
right.
this.
That's why you're a hero. You're a hero.
Thank
You're my
you.
hero. You're my new hero. I'm not kidding. You are going to save children. You are going to save people from going through hell. And parents who are
Yeah.
listening to these doctors, because the doctors are like, if you don't do this, your child's going to kill
Yep.
themselves. You know what I keep saying? God forbid I have to say it, but where are the kids? Where are the dead kids? Where are the kids who are
Right.
killing themselves? They're not. They're not.
And
There's
telling
no,
a parent that, the kid thinks that also. And I did.
oh
I
my
was told
God.
the whole thing that trans women don't live long. You're
Oh
not
my
going to see
God.
30 unless you get all these surgeries done.
This is
Like, you're
insane.
not going to make it. Hmm.
I mean, I can't even believe you. Oh man, you're spilling the beans, my friend. You're spilling
Okay.
the
It
beans.
was time because I had never seen an in depth story
Nope.
when a child goes through a
That's
rapid
right.
medical transition
That's
that
right.
they're advocating for right
There's
now.
nobody doing what you're doing. That's why we
No,
got to get you my little YouTube channel. But people watch my channel. So
they
we need to
do.
get
I
you on.
do.
We need. Thank you. We need to get you on a bigger platform. I'm going to help you. I have a lot of
Thank
connections. I'm
you.
not kidding. We need to get you on every major
Because I've just
station.
never seen a story like this.
Nope, there hasn't. I'm going to get you
And
on
then the
everything.
cover ups after,
Ugh, the
like,
fact that they literally snipped you and were like, "Yep, we don't even know who you are."
yeah,
They got rid of your records, everything.
yep. I
Wow.
finally was able to get the documents. They're all blank. The dates are listed every time I was in the hospital, when I was there, appointments
What?
after. They're
I'm
empty.
that is malpractice. I'm going to tell you right now. That is
Yeah.
completely illegal. It's illegal.
They
You
know what
can't
they're
wipe out.
doing.
Oh yeah.
Hmm.
Oh
And the
yeah.
crazy part, I'm in a red state.
I can't even believe it. It's totally shocking.
Like, of all places, yeah. That's what that was going on.
Well,
This
because it's
gender
money.
clinic was fascinated with trans kids. I felt that from when I was in there.
Is it still open, that clinic?
Oh yeah. Hmm. I still got to go pick up the hormones from there.
Oh my God. It's
See, they still get
absurd.
a check from me. They'll never stop.
They'll never
Okay. I
stop.
have no organs to produce testosterone anymore. So it's either that or osteoporosis or something. I don't
No,
know.
all kinds of
I
health
just discovered
problems.
that can happen too.
Also, the
Yeah.
Lupron, the long-term
Yeah.
effects of Lupron have a lot of effects. These people owe you
Yeah.
so much, my friend. They owe you beyond so much. They did. I do believe what you said, that they lied to you. They did.
Oh yeah, absolutely.
And so now you're
Like
the
the
one who's been,
deception to me and my
and
parents,
your parents.
unbelievable.
How are your parents these days? Are they struggling?
Yeah, of course.
I'm sorry.
They're the ones that actually encouraging me to talk about this. They've wanted me to for a long time, but I was so embarrassed. I was so
Oh,
embarrassed.
I
Like I
know.
just lived my life as stealth because I
Yeah.
hated the idea of me being a trans person.
Yeah.
I truly thought that I could skip over that
Yeah.
in a weird way.
Sure.
But then now somebody who's actually been through a childhood transition needs to say what it's like.
That's
People
right.
don't know.
They
People have
don't.
no idea.
They don't.
I've gone through like almost 6 procedures, like all kinds of plastic procedures, all kinds of medications, all and I'm only 22.
I know. It's shocking. I'm shocked. But you're right. People, nobody's stepping up. Nobody,
Mm-mm.
because I think we don't have a lot of, maybe a lot of people your age are coming to terms with
No.
what's happening. These kids are still young. They're like 14,
Yeah.
15. And so they think their life is amazing or
Mhm.
whatever, or they're scared to say it like
Yeah.
you said, of course,
I
because
know
there's
there
no,
are some like me, but
Mhm.
they're stealth and they're embarrassed.
They're embarrassed. Also, this
Mhm.
community is disgusting. This community is
Yeah.
so mean and nasty. The
They've
way
been very
they
mean to me.
Ooh, I'm sure they are. They're mean to me. They hate me.
Mhm. Yeah, I've told this story in some spaces and privately with some trans people,
Mhm.
and they've been very mean.
Because they don't
They
want.
said that I should be lucky.
First off, F yourself. Secondly, what you're doing is helping our community. But you see,
Thank you. That's what
my
I'm
God,
trying to do.
there's so much narcissism in our community and there's so much self-centeredness. Like,
They
I
are.
saw it.
No
It's
wonder
like,
I hated them.
that's
Like
right. What the hell are they talking
like why
about?
is it all about them? Like I
Because
will
they're
never
narcissists.
understand about like for the bathroom. If
Right.
somebody tells me that
Right.
they're uncomfortable, you'll see me out of there in 5 seconds. Why would I
That's
want to be in there? That's
that's right.
weird.
That's
Why are you
weird.
fighting for that?
Yeah.
Why do you want to make everyone uncomfortable for your
Yeah.
benefit?
That's right.
That's
That's
gross.
right. Because they're not trans, really. I think there's something else, and they
Yeah.
don't
They're
care about
attention seekers.
their
Like,
attention. Yeah, it literally created some kind of weird narcissistic community where it's me, 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 right? So I keep telling people, detransitioners don't bother me. In fact, I have like my heart
no,
goes,
I have so
you,
much empathy for
oh
them.
my God. So that's the thing that's so weird about these other trans people. Why are they? They're like, oh, we can't have people saying that. It's going to take away. We have to
Yeah,
have
I was
people
told
saying
that.
it.
Hmm.
I know.
They
Yeah,
told me
totally.
never say that because it's going to
Never
be a
say it.
bad look on all of us.
That's right. That's right. That's what they say all the time.
Yeah.
Yep.
And I was told to be grateful because they all wish that they could transition young and that they could look like this.
They're just
And I'm
saying
like,
that. They
but do you know the cost that I paid? Like, I
fucking
gave up
assholes.
so much of my life that I never got to experience because I was
Wow.
on an operating table
Yeah.
all of being a teenager and a kid.
But they're not listening to you. They're only looking at
Mm-mm.
how you look. That's what they're looking at, right? So they're not listening to your actual story because it's about
No,
them. And I hate when people say that in this community. I wish I could have transitioned when I was 14. You know what? F off. You can't
no,
say that now because you don't even know what that even means, right? You have no,
no.
and then if they listen to you, that's why your story is so insanely powerful because one kid is going to hear you. One kid, maybe a million, but one kid will
Yeah.
hear you and one kid will go, oh, I don't want to go and do that. And you'll save this kid's life.
Hey, can you believe I've been modeling in Chicago for 2 years and no one's known I'm trans.
No way.
Now they
No
do.
way. But I think it's awesome that you're coming out now. I do. I think
Thank
you
you.
are
Yeah,
very
I'm ready.
powerful. You're
I'm ready.
ready. I can feel it.
Yeah.
Look, I just want you to know we're going to end here, but I want you to know I
Mhm.
want to bring you back because it's
Anytime.
I want to bring you like live so people can ask you questions. I mean,
I would love
you are
that.
gold, and I want to help you however I can help you, Brianna. Get yourself out there and your voice bigger, and really use what happened to you as a. It will make you feel better. I do believe that
Yes.
it will.
And my
It
goal
will.
in this is I feel like after everything I've been through,
Hmm.
within the last few weeks, I've been called to talk about this. Like something has told me that it's
Totally.
time.
Totally.
I'm sick of grown adults going to the White House, going on
Eh,
TikTok, saying kids need to do this.
I
It
know.
saves lives.
Oh my God.
And they have no idea
That's right.
that the doctors are profiting from that
That's right.
and what this feels like to go through
Thank you for saying
and
that.
what you lose.
Thank you. That's what that pisses me off too. You're not even a trans kid. You don't even have kids, right? Like, how dare you keep saying that
Yeah.
kids have to transition? That's why you're powerful. They can
Yeah.
never say anything to you. You know what they're going to say to you, Brianna? They're going to say, "Well, it didn't work out for you, but maybe you
Right.
should." That's what they're going to say. The same bullshit that they always say.
Yeah.
And like, you guys can all go F yourself. Brianna's a hero, and Brianna will
Thank you.
save people. No, you're a hero to
Yeah.
this community. You are
I
also
want
a
to
hero
stop
to
our
kids.
community from being exploited also
Thank
from
you.
doctors. They
Thank
know
you.
that it's a fat check from us.
Oh,
And so they will push you, especially if you're a child, to do
wow.
everything.
Wow.
Because then you're
Just
stuck.
wow.
Like I said, I have to go to them forever.
That's right. Forever you're medicalized. That's what people don't
Yeah, even
understand.
after what they've done.
Even when they make you a cisgender woman, you're still going to have to take
Whatever
hormones.
that
You're still,
means.
that's
Like,
right. I'm like, how is that a cisgender woman? They're not telling you that you have
yeah.
to medicate for the rest of your life, and
hmm
your vagina is going to be a certain way. That's not like an
Yeah.
actual real woman's vagina.
Yeah. Now I have no genitals
Oh my
at
God,
all
Brianna. Oh God.
because it completely collapsed
It
internally.
collapsed.
hmm Yeah. And every doctor refused to fix it. They were
It
like,
is
it'll
just
kill you.
I just am so mad. So I think you're right. I think you've been called to this. It's your purpose. You
hmm
know, you had to go through this crappy shit that happened to you as a person, but I believe that you have found something that will sort of make you feel better about the shit that happened to you.
I think so too.
I can
Yeah.
feel it from you. I think you feel you seem very
People just need to
empowered.
know the full story
That's
of
right.
what they're trying to preach right now.
They are preaching lies and deceit
hmm
at the expense of children. It's bizarre.
Kids need more time.
Oh my
That's the
God.
one wish, if I could have anything
Yeah.
back, is more time to
Thank
figure
you.
out what is the right way to transition.
Yeah.
Because thank God I like presenting as female,
hmm
but I'm still now realizing at 22,
hmm
maybe I didn't need this. I don't need to look like this.
Wow.
Like, I just
Wow.
needed more time.
I agree. I mean,
But I was told by doctors, no, you need this surgery, you need this surgery, you need these drugs, and then you'll be happy.
did they ever
Mhm.
tell you that you weren't going to have a sex life?
Nope, not at all. I didn't
Just
know
wow.
anything about the blockers, actually.
Yeah, they didn't even tell you the side effects. The
They only
long
told
term.
me like the effects of the changes of estrogen
Wow.
and that I had to take the blockers and the other testosterone blocker.
Yeah.
They were like, oh, you just have to take those two with it.
Wow.
I had no idea even what they were.
I mean, that's malpractice, by the way. Your
Mhm.
parents have a big
Yeah.
lawsuit on their hands. Seriously, they
Yeah.
could, and you as
These
well.
kids cannot give actual consent
That's not
about what they're
consent.
taking.
They keep saying a
Yeah.
kid knows who they are. I'm like,
Yeah.
I have an 11-year-old kid. Like, believe me,
Mhm.
he far from knows who he is at 11. And
Right. Okay.
to make a drastic change to change your actual sex is so absurd to put on a child.
And I've had people in our community tell me that. They were like, well, didn't you take it and sign like a paper? And I'm
They
like, sure, but I was 14.
Duh. What the I hate this
Like,
community
I also
sometimes.
signed a paper saying that it was okay that I wasn't going to have kids
That's right.
because I was 14.
That's
And I
right.
don't ever think about having kids.
20-year-olds don't even think about having kids, let alone
Yeah.
a 14-year-old.
Not even 10 years later,
Right.
now I'm thinking about kids.
Right. And there you are.
Mhm.
And also sex. Sex is a big deal to me. I think
Yep.
sex is very important.
Never
and I
will know
think
what that's
you will
like.
never know what it feels like.
Mm-mm.
I mean,
Nope.
I am just so mad for you. It's sick. It's actually sick what they kind of
It's
do.
horrific.
Yeah, it really is.
And I know that it's happening more every year.
Oh no, they're ramping it up right now. And you know,
Yeah.
all of Europe shut that down and all of America
Thank
is
God.
ramping. It's bizarre. How
Because I don't want people to think I'm being transphobic.
no.
We just need more time. All of us. It takes so much time to figure out the right way
That's
to
right.
present ourselves and to transition.
But that's far
There's
from
nothing wrong with saying we need to give ourselves time.
you know, it's transphobic not to say that. It's transphobic
Right.
to not tell children that you can't really change your sex. That's transphobic.
Yeah.
That's
I
fear
wish
of
I would have been
trans.
told that.
Those people were transphobic because they don't want you to be
Mhm.
trans. They want you to be a woman. That's transphobia right
Yeah.
there. So our community can go F itself if anyone says anything to
Honestly.
you. They're
Yeah.
going to speak to Trampaw. Let me tell you. There is
Okay.
no, yeah. I got your back, friend.
Sick.
You are, No, because I
Thank
respect you.
you.
I feel for you. I think you are going to save so many lives. This community is built on a false foundation, and too many bad players have entered the game who are lying and deceitful and nasty and
Yeah.
making crap up about you. Have it. You literally have the lived experience. They can't say
Yeah.
anything.
Doctors and especially these gender programs and
Oh,
clinics, they know that these kids are vulnerable,
that's
they're
right.
mentally hurting,
That's
their
right.
families are panicked, they
Yeah.
don't know what to do, and they just want their kid to feel normal. The kid
Wow.
just wants to feel like a normal person, and that's what happened to me.
That's right.
And they said, "This is what we can do to make that happen." And it's going to
Wow.
drain your entire childhood. You're going to give up everything to do this, but we're not going to tell you what we're actually doing because we don't even really know.
Wow. It's just, I'm like sitting here like, am I actually hearing this? Is this really? But that's the reality of
Yeah.
it. That's it.
And
No
I
one's
can't even
ever saying
imagine
it.
what other programs are like in like blue states.
Oh gosh,
This was
dude.
happening in the Midwest.
That's right. And I live in California. Let me tell you, if you don't
Oh,
transition your child, oh, actually, it didn't pass. They were trying to make a law that if you don't affirm your child's gender, they will take your child away from you. Can you, what? Take your child away as child abuse. I'm like, wait a minute here. What is happening? Yeah,
that kid's
totally.
gender might change tomorrow.
That's right. I'm like, you're not,
Like,
if you touch my kid, I will gnaw your
you
arms and
crazy?
yeah, get away from me. Like, that's
Like,
child
as a
abuse.
trans kid, if I ever have a kid in the future, slow down.
That's right.
Like, trust me, I've been there.
Um, yeah,
Like,
if my child said they were trans, I would not I would be like, we're gonna go to therapy, kiddo. We're gonna figure
yeah,
out what that even means. I'm
because
trans.
I think we blurred the line so much about what being trans is.
That's right. That's right.
Like,
Yep.
we've made it seem like it can be every single feeling
Yep.
that doesn't align with like traditionally masculine or feminine.
That's right.
And we're immediately selling like all these surgeries, all these blockers, all these
Wow.
hormones that
Wow.
people, and they're not telling you what they're going to do to you. I
That's
still
right.
have no idea
No,
what the effects of the blockers and the hormones I've been on are
that's
going to
right.
do.
No, because you're
I'm
still
still trying to
22.
figure it out.
Oh, the
Mhm.
long-term effects are pretty. I'll send you all the information because you
Yeah,
should know.
please.
You should know what you might be. And it doesn't necessarily mean it's going to happen, but certain things can
Yeah,
happen.
I
I mean,
would
I
like
think,
to know.
yeah, I think
Yeah.
already things happen to you that you probably don't know
Mhm.
because
Yeah,
because
menopause
for,
at 16 is crazy.
oh my God, do you know how date? First off, I keep telling you, you have to go through puberty. The fact that they would
Yep, I
block
never
your
did.
no, they blocked your
Mhm.
puberty, which is so insane on so many, so it's because you look that way. That's why. So you feminized. They
Mhm.
feminized you.
Yeah.
They hyper feminized. You don't have any
Yeah, they
masculine
base
traits.
yeah. Mm-mm.
None.
Nope.
You don't even have an Adam's apple, do you?
Not
No,
really.
you
Yeah,
don't.
there's like a really tiny
Nope,
one, but you
you
don't really
don't.
see it at all.
But women have
Mhm.
that too. So no, you
Oh,
don't have
yeah.
anything that I would ever say, she looks a little, nope, nothing. Even your
Even like my
hands.
body, yeah.
I know, look
My
at your
hands are
hands.
really
They're
thin
so
and small.
feminine. Wow.
Mhm.
Just wow. See what it does? That's why it's so insane. The whole thing freaks me out.
Yeah.
It's so
It felt like
futuristic.
like I said, it felt like an experiment
Hmm.
to see
Hmm.
how much could we transition a kid,
Hmm.
like,
That's
all
right.
before adulthood. And
That's
my
right.
parents and I talk about that,
Yeah.
that's what they were trying to do, and they were excited about it.
Do you think your parents would ever speak out about this publicly
Yes.
or? Oh, wow.
Oh, yeah. They're
Oh,
ready
I would
to.
love to talk to your
They've been
parents.
ready before I was. They were waiting for me
Oh,
to be.
oh my
Mhm.
gosh. Wow. If ever your parents want
Yeah.
to do an interview with me,
Oh my god,
I would
yes.
be honored
Mhm.
beyond belief. I'm not even
Yes, you would love
kidding.
them.
So let's talk about that. So, is there anything that you would want to say to maybe parents out there, or even a kid who might be struggling, or anything that you think? Yeah,
Yeah.
yeah,
2 things.
yeah.
1, it is okay to not fit the mold of what we think a traditional boy and a traditional girl is.
That's right.
It's okay. Even as a boy, if you wanna do your hair, makeup, dress a certain
Right
way,
on.
do it. I wish I had time to do that,
Mm,
honestly.
yeah,
It made me would've probably go about transition differently.
yeah, yeah.
And then also for parents, talk to your child and
Mhm,
take your time. Talk to them. Let your child speak. I didn't really do that very much.
mhm.
I
Yeah.
just said the feelings I had, and I was kind of told what to do from there.
Wow.
And then I was also influenced by a lot of trans content online, and it was all older trans people wishing that they were younger to do it.
That is
So I had that along with the doctor saying that.
right.
That
That's
like you
right.
have the chance to do it all right now.
That's right. You were full on indoctrinated and influenced
Absolutely.
by
The
whatever.
trans media that I was consuming, like jazz
Oh,
and all that kind of stuff. And my heart breaks for her because I
I know.
understand.
Yeah.
But also just the trans activists online, especially around that like early 2010s,
Hmm.
it was all older trans adults
Yeah.
wishing they were younger to look a certain way
So
in their
weird.
transition. And it ingrained in me that I maybe have the chance with these doctors
Yeah.
to not have that happen
Yeah.
and to just be a regular woman. I've
Wow.
only now in the last 2 weeks have accepted I am a biological male. I
Wow.
present as a female,
Yeah.
and there's nothing wrong with that.
No,
And I
it's
just wish someone would have just said that.
God. Because I don't know why. I don't know why there's this idea that our biology doesn't count for us anymore and that
Right.
trans women are women and like what is happening with this?
No,
They're
we have
not.
very different bodies.
They're
It's
just not
okay.
women. Like what? It's
Like
the
even
it's a
among biological women have different needs. So you think we don't?
but you see what you do when you lie to young people. They lied to Briana, and then she grows up thinking this thing is going to happen, and it doesn't. And then now she's the one. No one else. Everyone basically bailed on you. Everyone jumped ship and
Yep.
left you having to pick up the pieces as a 22-year-old.
Yeah.
That's why this conversation is so incredibly important because that's what's happening. Once you're no longer cool anymore or whatever, you're just a 22-year-old and like
Yeah.
move on and you're causing problems. We're not going to talk to you
Yep.
anymore. That's what's going to happen to all
Yeah,
these other
because
kids.
I refused to not go through another surgery.
Yep.
They would have if they were still trying to get me to do it, even though doctors were telling me I would die.
Wow. Just wow. Sick. The whole thing is sick. I hate being trans. I'm not even
I
kidding.
swear. Tell me about it.
I like get away from me.
Too much.
I don't
Like,
want
what
to
are
be
they
around.
doing?
That's what. That's why I changed to a transsexual because I don't want to be
I
anywhere.
like that I've seen you say that.
I'm a
And I like that.
transsexual.
I think it's
had a
important.
sex change. Yeah, I don't want to.
Very different experience than
That's
whatever they're
right.
doing now.
I don't live as a trans person. I live as a man. I wanted to transition to be a man. I
Seriously.
don't want to be a
And
trans.
why does everybody want to be trans?
Oh,
That's
the
weird.
internet. It's cool. It's
Yeah.
hip. I mean, the young generation got sucked into it because it's like the hip, cool thing to do. But
I
give it
swear to
5 years,
God.
they'll all be over it. But me and you will be cleaning up the mess. That's why
Yeah.
these conversations are so important because I think you're being a very responsible adult by saying this, and I think these conversations are what everyone needs to hear, and then they're going to see what's happening in the trans community is a big lie. It's a big lie
It is.
at the expense
And
of
we're
young
being
people.
exploited,
That's right.
especially young people.
Especially young people. So Briana, thank you so much. You're such a lovely human. Oh
Thank
gosh, I feel so
you.
connected to you now.
Oh
I
my
feel like
God,
I'm
I'm
your
so
friend.
excited I got to talk to you.
I got your
Thank
back,
you.
friend. Don't you worry about it. And I
Thank
want to
you.
please leave her beautiful comments. I know you all are so great. You're just gonna leave and just I'll if you like, I can put your information that people can reach out to you. Is that possible?
Oh yeah, that's totally fine.
Excellent, excellent. So I'll put all her information there, and
Mhm.
everyone reach out to her, and let's give her Let's all help amplify her voice because she's
Thank
gonna
you. I'm
save.
so grateful.
Oh
I never
gosh.
thought I would be able to tell the story.
Oh
'Cause
my gosh.
the few times I had told it to trans people, they were awful. Like they
Awful.
said I was ungrateful, and they said that I had like a dream transition.
What?
Like people don't even know you're trans. Why are you complaining?
Oh my
Yeah.
God, that is so a dream. You're like literally telling them,
Mhm.
I don't, everything is ruined in my life. And they're
I'm
like, you had a
like,
dream.
they destroyed everything. What do you
Everything.
mean?
They don't care. Those
Yeah.
people don't care about you,
They have
friend. They
they're
care
not
about,
honest about how destructive this is to do
oh
this that young.
God, it's sick. It's just sick, the whole thing. Um, yeah, wow. I gotta go have a drink. Just kidding.
Okay, me too.
So, with
Can you
that,
believe
Brianna.
I had all that surgery before I could even have a drink?
No, that's what's so
Right.
twisted. Like the whole thing is so fucking
My age didn't even
insane.
start with a 2.
It's so gross. Oh, don't worry. We're going to amplify you, friend. We're going to save
Thank
those
you.
kids. We are saving those kids. I don't care what anybody
I pray for
says.
that every
You
night.
heard it right here. It doesn't work. So this
No,
trans community, trans kids are what do they say? Trans kids'
no.
rights, or I don't even know. It's
Like
just
trans kids matter. And I'm
matter.
like, these kids don't even know what that means.
They don't even trans. They don't know what trans means. Like what? It's
They
the
don't even know who they
adults.
are. I
That's
didn't.
right. That's right. It's the
Like
adults.
even in 1 year, I've completely changed. Let alone since
Wow.
I was 13.
Wow. Wow. Your story is fascinating. And I'm sure there's so much more we can get into. If I hear comments of you bringing her back, I'll bring her back. Okay. So if you all comment on there, I will bring her
Anytime.
back immediately. In fact, maybe I should bring you on one of my lives. I think it would be really great to
I
have
would
you.
love to.
Oh, that
Yeah.
would be
There's
awesome.
so many
Oh,
interactions I've had throughout this process from
yes.
all different types of doctors and throughout
Excellent.
these programs.
Excellent.
There's a lot. It's scary what
No,
goes
I'm going to
on.
get you connected to some important people who need your voice attached to it, because you will help us do what we're trying to do, which is we're trying to
I
stop
really hope
childhood
so.
transition. We're trying to do
Yeah.
that. It's not cool.
It'll
So
take everything from me.
everything. But I can tell right now you're going to bump it up so fast. I'm so excited
I
to
really hope
release this.
so.
So,
Yeah, no, it's time.
yeah, it's time. It's time. It's time. Thanks, Brianna. I really appreciate you
Of
so much. And
course, of
everybody,
course.
thanks
I
for
appreciate
watching.
you.
Yep. Send her love, 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 because she's going to help us move this stuff forward. And remember, like,
Yes.
subscribe. Send this to anyone who needs to see it. I'm not kidding. Send it to parents. Parents need to see this,
Yes.
and it will literally
Please.
change everything for them. I promise you. And
Yes.
and so with that, I'm going to see you guys all on Wednesday and the live. And I appreciate you all joining us on these conversations. They mean the world to me. So with that, hold on one sec here.